So for this next video, I'm going to be doing a bunch of different special testing on the knee, starting with checking for any MCL and LCL integrity. And that is done through the valgus and varus test, valgus for the MCL, varus for the LCL respectively. So for the first test, for the valgus testing and also the varus testing, I'm going to start by applying a valgus force along the lateral aspect of the knee, checking for any pain or just any end feel to get an idea. And I can bend them a little bit into 30 degrees flexion. And again, applying that valgus force. And then for the varus force, I can, same idea. So at 0 degrees, applying that force, checking for any pain and just the integrity of the ligament. And then going into 30 degrees of flexion, checking for any pain and feel of the ligament. So next one is ACL test, the Lachman's and the anterior drawer. They're both pretty similar tests. So for the Lachman's, I'm going to have the patient rest his knee on my thigh, just about 30 degrees of flexion. And then I'm going to wrap my hand around the posterior aspect of the tibia, and I'm just pulling anteriorly, checking for any pain and any exaggerated translation of that ACL. And for the anterior drawer test, I'm going to bring him up to a bit more flexion. I'm going to rest on his foot, and then same thing, anterior translation, checking for any pain and any exaggerated translation of that tibia. And while I have him here, I can also do the posterior drawer test for the PCL, where instead of pulling the knee anteriorly, I'm pulling it posteriorly and just pushing in, checking for any pain, just checking for any sort of laxity of that PCL ligament. And then for the posterior sag ligament, I can lift him into 90-90, and I'm just checking to see if his tibia dips down. I can see that bit of a sag between the femur and the tibia. Doesn't look like it, so this would be a negative test. His PCL would be intact. Next test is the McMurray's test and the Apley's compression test for a meniscal tear. So I would just bring his knee, just relax. I bring it into endpoints of flexion extension, checking for any pain, any kind of clicking. And then I can also apply, and then I can begin to apply external, internal rotation to the knee. Again, checking pain depending on what rotation is in. Just relax. And go ahead and lie on your stomach. And then for the compression distraction test, I would have the patient in 90 degrees of flexion, adding a bit of distraction towards his knee, and then again, external, internal rotation, and then adding a compression force down, doing external, internal rotation, and it would be positive for meniscal tear if the compression pain, if there was more compression pain than there was distraction pain. Next up, I'm going to check for patellar dislocation, so go ahead and lay on your back. And just keeping the patient in full extension, feeling around for that patella, and just adding a lateral glide to it. And this would be a positive test if there was either pain or patient apprehension from laterally gliding that patellar ligament. And then the last test is the Clark's test, where I apply a compression force down to just proximal to his patella. And I would ask him to do a quad set, so go ahead and squeeze your leg muscle. And a positive test for patellofemoral pain syndrome with that would be either reproduction of symptoms or the patient doesn't want to because they know that it will cause pain. And those are different tests for different aspects of the knee joint.